strength training for our hip internal rotation on the floor in a 90-90 position. So you're going to find your 90-90. Remember, your knee goes straight out from your hip, your heel goes straight out from your knee, and flex your foot. Front leg goes straight out from your knee, then you have the heel in line with your knee and flexing your front foot as well. Remember, if you need the block to access a better range, feel free to sit on it and find a better positioning for you here. I'm going to be on the floor, but aim to find the position that works best for you. So in your 90-90, we're going to be working our back leg. You're going to think of lifting yourself up. Aim to lift your foot off of the floor. You might even kind of lift it a little bit. Feel the rotation of your femur towards the inside of your body or down towards the floor. And you're going to rotate while pulling the femur down. Rotate your pelvis down towards the floor. So you're going in opposite directions. Pelvis goes back, femur goes front. So find your position as far as you're able to go. And from here, just hold. Take a deep breath. Find yourself just sitting here, allowing all of the tissues to relax. If you need to lean back, feel free to lean back a little bit. That's up to you, depending on what you're feeling in your hip. So we're going to be training, so don't move yet, but we're going to be training moving externally with our femur, keeping our pelvis exactly where it is. And then later we're going to try to think about our pelvis being the one that moves and our leg is going to stay where it is. Take a deep breath in. In your exhale, keeping your pelvis where it is, think about rotating your femur towards the outside of your body. Push your shin and your foot down into the floor. Find 80% effort, squeeze more of your body. Find 100%, as hard as you can go. Squeeze through your arms, squeeze through your other leg. You're thinking of rotating towards the outside of your body, pushing down through your shin. Go as hard as you can, and now same amount of force, try to rotate your femur in, acting like you're trying to lift your foot. Instead of your femur moving though, think of trying to move your pelvis down and back a little bit more. It should feel like you're wringing out a towel. Keep pulling and take a deep breath. Stay where you are, but relax. So this will feel a little bit different than when you're doing it on a chair with a stick, because in that position you're thinking of moving your leg. In this position, your leg doesn't move very much. You kind of will feel it more internally, but your pelvis is the one that you're aiming to move. So the pelvis is the one that you're aiming to increase or help increase the range of motion. Taking a really deep breath in. Relaxing everything just a little bit longer. Okay, slowly start to rotate out. So keeping your pelvis where it is, rotate your femur out, push your shin and your foot into the floor. Increase to 80%, so go harder. Go to 100%, as hard as you can. Squeeze your whole body. Think about like you're trying to add a dent into the floor through your foot. Come on, come on. Go as hard as you can. 3, 2, now act like you're trying to lift, rotate, and pull the pelvis further down towards the floor. It might not move a lot, and that's okay, but keep aiming towards that crazy feeling deep inside your hip. Take a deep breath and stay where you are. Breathe. I'm gonna do that one more time on this side. Think about trying to be kind of tall with your upper body. It's easy to start to round the spine. If you round the spine, it might take away some, like that deeper feeling in your hip. So aim to stay pretty tall. We're going to do this one more time. Take a deep breath in. And your exhale, start to rotate your femur towards the outside, pushing your shin and your foot into the floor. Find 80% effort, squeeze more of your body, squeeze harder through that leg, go 100%, as hard as you can go. Come on, squeeze through it. Push it, you can do it. You got 4, 3, go harder, 2, same amount of force. Act like you're trying to lift the foot up and draw, feel the difference. Draw the pelvis down while the femur is actively going towards the inside of your body. Keep pulling, keep feeling that like twisting. 3, 2, take a deep breath and relax. Stay where you are. Try to breathe really deeply here, trying to calm your body. You got 15 more seconds on this side. Just breathing. Letting your body become accustomed to this position. Okay, take a deep breath in. Super slowly move your pelvis forward. Super slowly shake through your leg. Ooh. Shake it out a bit, and we're going to the other side. So, find your 90-90. That'll be crazy on this leg. So, knee straight out from hip, heel straight out from knee. Flex the foot on both legs. Nice and tall. Act like you're trying to lift your heel and then start to drop your pelvis towards the back of your body. So towards your foot. Take a deep breath in when you found your position and relax. So feel maybe the difference between this hip and the other hip. Let yourself breathe into this. Now that you did it on one side, you should be able to activate pretty well through this side. Right now you're just breathing. You're trying to become comfortable in this position. You got 25 more seconds. Finding your breath. Think about breathing through your whole torso. Your back expands to create more space for your breath as well, for your lungs to fill. Take a deep breath in. And in your exhale, start to rotate your femur out, pushing your shin down and pushing your foot down. Find 80% effort, so go a bit harder, squeezing more of your body. 100%, go as hard as you can. Other leg is squeezing, your arms, I'm pushing my arms into the floor. That might help you too. Come on, you got 4, 3, 2, same amount of force. Act like you're trying to lift your foot, rotating your femur, and try to pull your pelvis back and down. So keep drawing the knee and femur down while your pelvis starts to drop further. Take a deep breath and relax. Stay where you are. If you got some more range, just allow yourself to find this position and just be in it for a little bit. Again, finding that deep breathing. Take a deep breath. Round 2 of 3. Start to rotate your femur back. Push your foot, push your shin into the floor. You're at 60% effort. Find 80%, so go a bit harder. 100%. Go as hard as you can. Push through it. Feel that twisting, the wringing out of the towel sort of feeling. Aim for it. Do the same wringing out of the towel, but opposite. Try to lift up, draw, and pull. Wring it out. Pull down towards the floor in both directions. Femur forward, pelvis back. Take a really deep breath in and relax. Stay where you are. Got one more on this side. If your body is giving you more range, or if this is a position your body isn't as used to, you might feel a little bit of a difficulty activating the muscles and the tissues that we're aiming to activate, and that's okay. Just practice, aim to get that as much as possible. The more that you do this, as with everything, the better you'll get. Okay, take a super deep breath, last round. Start to rotate your femur out, push down as hard as you can from this position. 60% effort. 80% effort, more of your body starts to squeeze, your abs, your back, your other leg, 100%. Everything is squeezing as hard as you can go. Come on. Keep your knee down on the floor as much as possible. That way you're having all the pressure going to your hip. 3, 2, 1. Act like you're lifting up. Draw the femur down. Wring out the towel through the pelvis. Come on, act like you're lifting. Try to lift. And in that lift, you're pulling your pelvis down towards the floor. Take a super deep breath. Stay where you are and breathe, relax. Woo. Sometimes it feels hard to relax. You got a whole 45 seconds technically. 30 seconds left here. Just breathe. Super deep breath in. In your exhale, slowly rotate forward. Slowly, maybe help your leg to lengthen and rotate in and out. From there, letting your legs relax a little bit. Well done.